Hi, I'm Catherine Carter, Vision and Behavioral Health Advocate, and who worked on the Atticus Act. And I wanted to let you know for the 2022 session, I am working on a bill with Delegate Guyton called the Standardized Behavioral Health Screenings for Development and Implementation. And this complements the blueprint, and it really is a chance for struggling parents to reach out and ask for help. And to be honest, this is an inspiration of my positive experience in collaborative work with Howard County. The bill helps find kids like Atticus who are struggling to see clearly and maybe are going years with being mixed diagnosed and lacking the right vision care or school accommodations. It also can help kids like my daughter. After struggling for a really long time to find a local health provider, I finally reached out to the school, the middle school, and they gave me a list, and that's when I was actually able to form an outside health team for my child to support her IEP goals. And they were there to support her during the pandemic and as she re-entered high school. And we are continuing to see gains because we had those supports in place. And I have to say, when I registered all 5 of my kids this year and saw your new health questionnaires on the registration process, I was just smiling from ear to ear. To see questions about physical and dental health and eye exams, and to specifically see questions about if a kid wears glasses. All 5 of mine do. Now that my first grader Gaius' teacher knows that he wears glasses, she reminds him every day to put them on so he can see to learn. So with this screening, struggling students are identified and resources are put in place to support. Staff training, grants, support teams, student support teams, and special education teams can be better informed. I would like to see what you guys have done here statewide. I think it's a great model, and I think just like a teacher, when you give an assignment, and all the schools have been tasked, the behavior coordinators, to create screenings, create a rubric. Make it easy, make it standardized, because we're talking about equity in the grants. By 2026, there will be availability for the community grants of $125 million per year. And if a school district does not ask the right questions, and it varies throughout the entire state, as you can see in the documentation I provided, then those kids will not get access to the needs they have. And so I hope that you look and talk to your counterparts in other boards and other superintendents and find a way to see yourself to support this bill. Because you know what? It's kind of because of how we work together and all the great work you guys have given to me. So thank you once again. Appreciate the time.
Thank you, Kat, and for your advocacy. Megan Price.